Cancer sucks.
Hi, I'm Leah, one of your kidneys, part of your renal system. I'm a personal detox specialist, a hydration manager, and an overall MVP of waste removal. Now, like any hard workers, we sometimes run into problems, and one of our biggest is renal cancer.
Hi, I'm Megan, also known as renal cell carcinoma. I'm the most popular of all the kidney cancers. One of the most common types of kidney cancer is renal cell carcinoma. It originates in the lining of the proximal convoluted tubule and affects the kidney's filtration system. The other two types of kidney cancer are transitional cell carcinoma, which affects the renal pelvis, and renal sarcoma, which is a rare cancer that originates in the connective tissues. The most common kidney cancer in adults is renal cell carcinoma, and the Wilms tumor is the most common in kids. The Wilms tumor is the most common in children. It affects either one or both kidneys and presents as the same as renal cell carcinoma. While most causes are unknown, there are some risk factors to be aware of. Smoking, obesity, high blood pressure, chronic kidney disease, crappy genetics, environmental factors such as pesticides and cadmium, and my favorite, men over 45.
Hi, I'm Leah. I'm your left kidney. Today I'm going to tell you about diagnosing this. What can be done to diagnose cancer? Well, you can do blood and urine tests. Urine tests will help show blood in your urine even if it's not visible, while tests like CBCs can help show if you have anemia by showing you your low hematocrit or hemoglobin and even red blood cell count. Occasionally polycythemia is present, but it's rare. Sometimes that happens in response, as my response to low oxygen, and sometimes it's in response to, the cancer making its own, like increasing erythropoietin levels. Also, a CMP is good because it will, when cancer gets in your blood, it often throws off the chemicals in your body. It'll show you things like increased alkaline phosphatase levels, lactate dehydrogenase, or even increased calcium. But more definitive tests would be ultrasounds, MRIs, CT scans. MRI is not the best, but it is the best if I'm not quite feeling up to taking contrast dye. These are often all that are need to diagnose, but if you need a more definitive answer, a needle biopsy of the tumor on me will give you a much better answer. Then they'll take that and they'll give you a Furman grade. Grade 1 means it's looks a lot like me. The cells look a lot like me. They're slow growing, better prognosis. Also, grade 4, though, doesn't look a thing like me. It's more aggressive, fast growing, very worse outcome. They will also give the cancer stages 1 through 4, with 1 being localized to me and 4 having metastasized somewhere else in the body. Okay. So as for treatment, what can we do to help stop cancer? Well, in the early stages, we can focus treatment just on me. Doctor may decide to take me out altogether, but that's okay. It's called a radical nephrectomy, and it is the best way to get rid of cancer. You have 2 kidneys and you can live fine with just 1. But if we're lucky and the cancer is 4 inches or 10 centimeters, they may be able to do a partial nephrectomy, which is just precisionally cutting out the tumor if it's not centralized. Cryoablation is another form. It utilizes gases like nitrous oxide to freeze the tumor. You also have radioablative therapy, which uses electromagnetic waves to basically melt the tumor. Microwave ablation is similar to radiofrequency ablation, it's just a stronger microwave. Then there's also stereotactic ablative body radiotherapy. It's also known as SABR. It is precision radiation that minimizes tissue damage to the rest of the body. If the cancer has spread, however, we're going to have to pull out the big guns and do systematic treatments. You need targeted drug therapies. These use specific medications that target a protein in the cancer called tyrosine kinase, and that is what helps the cancer makes its own blood supply. So by cutting that off, well, a little long. Immunotherapy helps increase your body's own defenses by making more white blood cells available to help target the cancer. And then chemotherapy can be used, but it is rarely used in renal cancer, as renal cell carcinoma is the most prevalent form of renal cancer, and it is not very receptive to chemotherapy. Doctors, depending on the stages and the spread of the cancer, may choose to mix and match any of these treatments.
Hi guys, my name is Maggie and I'm your right kidney. So far we've talked to you about how renal cancer can be diagnosed, the signs and symptoms to look out for, and which tests can be ran to diagnose cancer. Now let's talk about what you can do to help lower your risk of renal cancer and the steps you can take to help keep us cancer free. You wouldn't want someone exposing you to harmful toxins every day, so why would you do that to us? Smoking increases your risk of renal cell carcinoma. With smoking, carcinogens are released into the bloodstream. Over time, exposure can lead to tumor growth. Not on my tubule. If you're someone who smokes, please consider talking to your doctor about ways to get help and to successfully quit. Lifestyle changes like loading up on healthy foods, drinking more water, and exercising can help decrease your risk of renal cancer. Don't worry, you don't need to be a gym bro or go all keto on us. Just move your body, aim for 6 to 8 glasses of water a day, and go green by adding more fruits and veggies with every meal. Another way you can help lower your risk of renal cancer is to be smart about your medications. Know which medications you're taking and how they can affect your kidneys. If indicated, take all medications with food and a full glass of water, and be mindful to not overuse certain medications such as NSAIDs, antibiotics, and even certain supplements. So what's new in renal cancer research, you might ask? Researchers are constantly looking for new medications and ways to combine and use existing ones to help choose the best treatment for each person. According to the American Cancer Society, new types of ablative treatments such as microwave ablation are now being studied for use in destroying tumors inside of the kidneys. Also, a new form of radiation called stereotactic body radiation therapy is being used to treat kidney tumors. This type of radiation uses beams of energy to carefully target tumor cells and inhibit their DNA replication. I'd hate for that to be me. Well, there you have it. We hope we were able to educate you on what renal cancer is, the signs and symptoms to look out for, how you can reduce your risk for developing renal cancer, and treatment options. Now go make some kidney-friendly choices today, and we promise we'll repay you in the long run. If you have any questions about something we might not have covered, or you just want to do some research for yourself, check out the links provided above to help you stay informed about what's new in renal cancer research.
Cancer sucks.
Okay. Oh my gosh, okay.
Let's zoom in.
We're your kidneys, and we approve of this message.